Hello, this is Jennifer Hood. I'm going to be doing the checkoff for the Indwelling Foley catheter on a female patient. So I'm going to go ahead and get started as if I were in the med or supply room. I have my patient's chart pulled up. Anna Pawlowski, date of birth is 5/5/1957, and I'm just going to verify that she has a current order from her healthcare provider for the Indwelling catheter, which she does. I see she has a current order for today to place the Foley catheter because she has some urinary retention. And then I'm going to also verify any allergies. And I see on her chart that she has an allergy to penicillin with the reaction of hives. Okay, so I've went ahead and verified that she does indeed have a current order from the provider. So I'm going to go ahead and gather my supplies. I've got my Foley catheter kit here. It's dry, it's intact, and it's in date, so it doesn't look like it's tampered with. I'm going to go ahead and grab 2 pairs of clean procedure gloves. And I'm going to bring an extra pair of sterile gloves just in case I have any issues. And I'm bringing tape just in case, and my kit actually didn't have any tape in it, so I'll be using this. And then I'm going to bring the patient's chart with me. Okay, so I verified that she has the order, I've gathered my supplies, and so now I'm ready to go into the patient's room. Knock knock. I'm gonna go ahead and sanitize my hands and introduce myself. Hello, my name is Jennifer. I'm gonna be your nurse today. And while I'm sanitizing my hands and walking in at the same time, I am providing privacy, and I'm also scanning the room for any safety issues, bumping the bed, making sure the brakes are on, that the bed is in the lowest position, and I'm also grabbing a trash can to place it near the bed for the procedure. So, hello, my name is Jennifer. I'm going to be your nurse today. Can I go ahead and verify your name and your date of birth, please? Anna Pawlowski, 5/5/1957. Okay, what she said matches her armband, which also matches her chart. Okay, Ms. Pawlowski, do you have any allergies? Penicillin, okay, and I'm looking at her band, and what she said matches her band, and it also matches her chart. And what is your reaction to penicillin? Hives. Okay, hives, it matches the chart as well, so I verified the patient's name, date of birth, and allergies. Okay, so Ms. Pawlowski, I'm here because your provider has put in an order for an indwelling catheter because you are having some issues with urinating, is that correct?
Yes.
Okay, have you ever had a catheter placed before?
Yes.
Yes? Okay, and did you have any issues with that catheter?
No.
No issues with placement or afterwards?
No.
Okay, good. And so I know that we had talked about your allergy to penicillin, but just to err on the side of caution, have you ever had any adverse reactions to latex?
No.
How about iodine or betadine?
No.
Okay, so she said no. And the reason that I'm asking that is that sometimes the kits can contain latex, or the cleaning solution may be iodine, and we just want to make sure that the patient doesn't have an adverse reaction. Okay, so I went ahead and verified everything, so now I'm going to get ready for the procedure. I'm going to perform hand hygiene again, and I'm going to go ahead and just put on some clean procedure gloves. And I said it earlier that I had provided privacy whenever I had walked in. Okay, so I'll put on some clean gloves, and while I'm doing this, I'm going to be raising the patient's, the height of the bed to an appropriate working level, which would be about waist height. As you can see, it's already there. I'm going to be working on the right side of the patient because I am right hand dominant. If I were left hand dominant, I would be on the patient's left side. And then I'm going to lower the bed rail on this side as well. Okay, so I've got my clean procedure gloves on, and now what I'm going to do is going to go ahead and position my patient. So I'm going to put her in the dorsal recumbent position, which she's on her back, and I'm going to have her flex her knees and then just relax her inner thighs for me. Okay, and now I'm going to expose the perineum, and just like this. Okay. So I have exposed, this is going to be, for purposes of this video, this will be her perineal area. Okay, so I've exposed the perineum. This is a good chance to make sure that I have adequate lighting, which I do. And so now I'm going to clean the perineum with a hospital-approved cleanser. We'll say for purposes of this that it's the cleaning wipes. So I would clean from top to bottom. Okay. I would only use one wipe at a time. So I would top to bottom, throw, grab another one top to bottom, throw, and grab another one top to bottom and throw. And so I've cleaned the perineum, and now I just want to identify the urinary meatus, which I have identified it here, as you can see. Okay, so I've got her all prepped and ready to go, and now I'm going to go ahead and remove these procedure gloves. And again, I have my trash can right here at my feet. And I'm going to clean my hands. And then I'm going to apply new procedure gloves so that I can start opening my kit. Okay. Put this to the side, and I will move my chart and hand sanitizer also. Okay. And my hands are still wet with sanitizer. I should probably pretend I'm putting it on. Okay, so I'm just going to put some clean procedure gloves on. Okay. And so now I'm going to go ahead and begin opening my kit here. I am not going to be using the bag as my garbage can. I acknowledge that I could, and because my patient is alert and cooperative, I could easily have my sterile field next to the patient. So I'm going to begin opening the catheter kit, and I'm going to start just one fold at a time, moving it away from my body because this is a sterile field, so I want to make sure that I'm not crossing over. Okay. I'm just going to push this so I have extra room here. Okay, so I've got that done. And so now I'm going to go ahead and grab the waterproof drape from the corner, shiny side only. And what I'm going to do is allow it to open like that. And I'm going to place it shiny side down in between the patient's legs, just below the genitalia. So making sure I don't cross my sterile field here. Ideally, I would be doing this at the end of the patient's bed. I wouldn't be flapping it around like this. But because I can't actually be at the end of the bed, I'm just going to be doing it this way. Okay, so I've placed the drape. I'm not going to reposition it because I'm not wearing sterile gloves right now. So if I wanted to reposition it, I would wait until the next step when I'm going to put my sterile gloves on, which is I'm going to remove these gloves. And I'm going to perform hand hygiene. And then I'm going to prepare to put my sterile gloves on. Okay. So I'm going to go ahead and open, lay it down flat here. Like this. I don't know if you could see that. So I'm going to move it to this side just so that you could see in the video. Not you don't have to move. So I'm going to open it just like this. Pulling out the cuffs. This just moved when I opened it. So just like this. Okay. Okay, and so what I'm going to do is with my non-dominant hand, I'm going to grab the right hand glove, use on the inner cuff so that I don't touch the outside. So just like this. Okay, and again, I'm only grabbing the inside there, not touching the outside. So I don't want to compromise the sterility. Okay, so I actually got that one on pretty good. Now I'm going to take my 2 fingers and go underneath the cuff here so that I can get my finger in here. And again, I'm not going to compromise my sterility. Okay, so I've got both gloves on, so now I'm sterile to sterile so I can, fix my fingers however I need to. Okay. And so I've got my gloves on, and so the next thing I'm going to do is I have the fenestrated drape, which I'm going to position over top of the perineum. So I'm going to grab it from the corner. I'm going to try to, there we go, okay. And I'm going to allow it to open just like this. And I'm going to can you grab that? I'm sorry, her little perineum fell. Go a little lower. And then I'm gonna drape this over the top of the perineum just like this. And then the little notches go on each side of the leg. Okay, so I've got that done. And so now I'm gonna go ahead and organize my kit, because again, I'm sterile here. So I'm gonna go ahead and place everything how I want it on my sterile field. So I've got everything here ready to go. So I'm gonna go ahead and open my cleanser. I'm gonna open this and I'm gonna put it on the cotton balls and I'm just gonna dispose. I'm gonna go ahead and open the lubricating jelly, put it in here and dispose. And so now I've got that ready to go. I'm gonna go ahead and look at the drainage bag and I'm gonna make sure that it's closed, which it is closed. And I am going to go ahead and attach the syringe to the balloon inflation port. So right here, I'm gonna go ahead and do that. So removing my cap. And I'll go ahead and insert here. Okay, so that's ready to go. And then now what I want to do is I want to remove the slip that covers the catheter tip. And so I'm going to grab that right here. And I'm going to pull this out. And what I want to do is, and I'm going to throw this in the trash, not going below my waist, and I'm going to just put the tip of this into the lubricating jelly solution like that. Okay. All right, and I am got everything prepped and ready to go. So now what I'm going to do is I'm going to start cleaning the perineum. I'm going to go from top to bottom, one cotton swab at a time, using at least 3. So I'm going to take my forceps and I'm going to grab the first cotton swab here and I'm going to go ahead and go furthest side from top to bottom like this, and then I'm just going to drop it, and then again top to bottom and drop it, and then again top to bottom, drop. And just to err on the side of caution, because I know we want to prevent CAUTI, since I have 3 more swabs, I'm going to go ahead and use all 6 swabs. So top to bottom, top to bottom, and top to bottom. And now that I'm done, I don't need my forceps anymore. I'm going to go ahead and put them in the trash. Okay, so I've cleansed the perineal area. And so now I'm ready to begin inserting the catheter. So I'm going to take my non-dominant hand and I'm going to pretty much keep my non-dominant hand here the whole time, because I'm going to spread the labia, exposing the urethral meatus. And so now what I'm going to do is I'm going to grab the tip of my catheter with my dominant hand about 3 to 4 inches down. So right about here. Okay, and I'm going to tell my patient to just relax, and I want her to take a deep breath and just bear down gently. So I'm going to begin inserting the catheter. And what I want to do is, when I see urine, I'm going to continue to advance the catheter about another 1 to 2 inches, just like this. And I will acknowledge that if there was resistance met, I would have my patient take a deep breath. I would try it one more time, but if resistance continued, I would just stop altogether and notify the healthcare provider. Okay, so I saw urine, I advanced another 1 to 2 inches. So I'm going to get ready to go ahead and inflate the balloon. So I've got the catheter here with my dominant hand, and I'm just gonna slowly inflate the balloon. Oops. Let's try that again. Got some resistance there with this. Okay. So I'm going to inflate the balloon slowly. There we go. Okay. And so I have inflated all 10 ml into the balloon. So I'm going to disconnect the syringe and drop it. Okay, so now I can let go with my non-dominant hand, and I can gently just kind of pull, and any slack can come out because the balloon is inflated, so it should anchor to the bladder. So that is done. And so now what I want to do is attach the excess catheter tubing to the inside of the patient's thigh using my tape. And I want to make sure that I allow some slack because I don't want to have any tension on the patient. So I'm going to take my tape and I'm going to get it stuck to my glove and attach it to the inside of the patient's thigh, just like this. Okay. So I've done that. I want to make sure she's comfortable, and I'm going to go ahead and start cleaning up my area here. So I'm going to remove the I don't want to break it in case I need to reuse it, but I would remove the fenestrated drape, and I would provide any additional perineal care that's needed. And then what I'm going to do is I'm going to take my drainage bag, and if the hospital policy allows, we'll let the bladder empty completely. And then I'm going to attach the drainage bag below the bladder to a non-movable part of the bed. And then I want to make sure that if there's tubing lying around that that's secured as well, but it's not blocked or kinked or anything like that. But I definitely don't want it dragging the ground. And so now I'm going to go ahead and remove my gloves. I've already cleaned my area before I remove my gloves, but I want to make sure I put the kit back together. So I'm removing my gloves. I'm going to perform hand hygiene. And we're going to go ahead and drape the patient back up. Again, all this stuff would have been gone. Make sure that the patient is comfortable. Lower the bed back to the lowest setting, raise up the side rail, make sure she has her call light, make sure she's okay. You can relax now, you can relax your feet. And then I would go and document. I would document the amount of urine that came out, the color and the clarity of the urine, as well as the size, a catheter, which was the 14 French, and then the amount of sterile water that I used to inflate the balloon, which was the 10 ml. So I checked all of the safety settings. She's low, side rail is up, call bell. I would foam out and leave and document, and that's it. All right, thank you.